Hi, my name is Brittany Marandola. I'm a mental health technician on the inpatient psychiatry unit at the University of Vermont Medical Center. I'm also the director of this project that I'll be presenting to you today, which is iPads on inpatient psychiatry. So our current practice is to use laptops to document on our patients on constant observation. We are required to do it electronically for the electronic health record. Some of our patients are psychotic, manic, suicidal, and they have to be watched at all times. So we're documenting on them every 15 minutes. Some of the issues with that is the size of the laptops that we're using, the cost, because they are being replaced annually due to wear or damage, and ergonomics on the unit, which is difficult because we're not always sitting. Often we're running around following a patient or standing. Oftentimes we don't even have a desk or a table to sit at while we have our laptop. So those can cause muscle issues or repeated stress injuries on our muscles. So currently the Dell model of laptops that we're using on the unit weighs 3.4 pounds, and the dimensions are 13.3 inches by 9.1 inches by 0.8 inches, and they're a flip-top model. So it's just a regular laptop, but they're big, and 3.4 pounds might not sound like a lot, but it adds up when you're holding it for 8 hours. They're bulky, they're cumbersome. If we have a codate event, which is a violent situation, we have to close the laptop and put it down. Sometimes that can hinder our response time and make it even more dangerous for us and the patients. And the cost for each of those laptops, we have about 20 of them, is $950. So that is around $20,000 a year that we're spending just on laptops. And like I said, that they're replaced annually due to wear, damage, and we often have to upgrade the software on them because it's outdated. We're using a PC model, so there might be viruses or some kind of computer virus or malfunction on it that needs to be fixed. And relating to ergonomics, the laptops, like I said before, are heavy. The size of them is bulky, difficult to carry around, but we are required, all of the staff of the hospital are required to take a ergonomics training session as part of our annual evaluations. And it's a little seminar that we take to teach us how to properly sit at a desk and type without getting an injury. Here it says work-related musculoskeletal disorders are a leading cause of absenteeism in the workplace, and ergonomic modifications have been shown to reduce frequency of pain in the employees. So the strain of carrying this laptop around in not ergonomically comfortable ways puts strain on our muscles and leads to injury, which would lead to absenteeism, which leads to loss of money for the hospital, an unsafe working environment where we're understaffed. And this is something that we're required to do with the carrying laptops around, so it's not something we can really get around doing. So the solution to this would be getting iPads for the unit, replacing our current laptop models with the iPad Pro. These are smaller in size. They weigh less than a pound, so less than a third of the weight of our current laptops. They are about 9.7 inches by 6.6 inches. So it's about the size of a book, weighs about the same size as a book. And they average, or the retail cost is $599 per iPad. And that's without the cases. I didn't include the price for the laptops of any case for that either. So I kept it just the price of the tablet itself. And they're safer for a couple of reasons. For infection control, they're a lot easier to clean than a keyboard with lots of crevices. They are lighter, obviously, and they allow us to respond faster to a Code 8 event where we're not having to close a laptop and set it down, worrying about it breaking or being used against us, which has happened before in a situation with a patient as a type of weapon. And part of the solution as well is hiring an ergonomics consultant. Ergonomics is the science of designing the workplace. So even though we're trained every year on how to sit at our desk or properly adjust our chairs or exercises to keep us safe, doing work-related things like typing on the laptop or sitting at a desk for long periods of time, we have a very unique work environment on inpatient psychiatry, and it's not an office setting. So like I said, often we're walking around. You might get stuck in an area where there's no desk or even a chair, and you're awkwardly holding the laptop, and it puts strains on your muscles and your back, and they can be potentially dangerous to our staff, and we need to work to change that. So by hiring a ergonomics consultant to come in, evaluate our unique work environment, and make changes or an ergonomic plan to train the staff how to properly utilize these laptops in a way differently than use the iPads in a way differently than we were using the laptops to keep our staff safe and injury-free. And while it might cost quite a bit to initially get an ergonomics consultant on the unit and to evaluate our environment, it really has big benefits for a small change. There's an ergonomics consultant, which would lead to cost savings, increased employee morale. It would increase productivity and quality because our staff isn't injured, we're comfortable, we feel good, which leads to profits, no lost wages due to work injuries or claims due to work-related injuries. And this all leads back to return on your investment of hiring an ergonomics consultant to come in and make it a safer environment for our staff. So this is the project budget. To replace the 20 laptops, it would cost just under $12,000. The software setup would be about $1,000. The cost for the project director working in overtime for about 6 months would be $3,000. An ergonomics consultant was estimated at around $5,000, and training of all the staff is another $5,000. So it comes out to about $26,000 to replace 20 laptops and get an ergonomics consultant to come in to train all of our staff on the unit to properly use them and ways of properly sitting or standing and walking and utilizing the equipment to keep them safe from musculoskeletal disorders or stress-related injuries. So in conclusion, the iPads are smaller, they're more cost-effective, and they're safer for our patients and staff and patients. And it's a great investment. It's actually less to get the iPads then just themselves, then what would be to replace the laptops like we do annually already, but the extra cost of the ergonomics consultant does increase it, make it more expensive than what we're already paying. However, because of staff safety and the increased morale and the quality of the work that we'll be doing as on a safer unit and being healthier in general, makes it a great investment. And I'm really excited to work on this project and hope that you're excited as I am about it. And if you have any questions, please let me know.